Dr. Hussain Bakshwalaji.
Hello.
Thank you very much, and to stand on the Latif auditorium is always honor, and we have been coming up and down on this stage since 1977, and this was an honor that I have been asked to deliver a few notes about my work in Isra University. The topic is curriculum development of public health, community medicine, especially MPH, MPhil and PhD courses in Isra University. The introduction is that the postgraduate curriculum development is a special field, and we have been discussing in the medical education since morning that education is one of the important part, whether it is a health professions or any profession. We have developed and finalized following curriculum of public health and community. These two words are interchangeable, community medicine and public health. Sometimes people think that community medicine is separate and sometimes public. So public health is the bigger term, I will say. So please consider it as a public health as a major subject, as we have surgery, but there are many subspecialties in it. MPH, MPhil, PhD, and also we reviewed the MCPS courses and FCPS courses, and the objective was to share curriculum development experience in community medicine, to recommend uniformity in credit hours. That please you should understand that teaching hours, contact hours and credit hours. I think the medical education people can understand better, but the credit hour is the main thing that your course will be having the weightage at the international level. The methodology was, I must mention that this paper was not worthy for this approval, but I think because I was professor and dean in Liaquat University, so I think they have selected this for oral presentation. Otherwise, if you will have sent this in any international conference, then the study type and other questions may not be relevant and your paper may not be accepted. So thank you, Mr. Chair, that you have accepted this paper, which was not as fine as a study, but it was an experience, so I thought I must share. So duration of the study was last year, but actually we have been working since 2014 onwards till even today. We are considering reviewing and amending our curriculum. So curriculum is a continuous learning, evolving process. Few results. The curriculum must meet the criteria. This is the first important result. If you will not study the criteria of Higher Education Commission, then they will not accept your curriculum or course. If you will not meet the criteria of PMDC, this is another area. And if you are not meeting even your own university regulations and other requirements, suppose academic council, board of studies, so on and so forth, then even your course will, curriculum work will not be accepted. And CPSP criteria is more difficult, and all are charging a huge amount of any course if you want to get recognized by CPSP or PMDC, and you have inspectors and so on and so forth. The curriculum must be approved by Board of Study, Board of Faculty, Academic Council, otherwise you will not have your curriculum approved. We have observed, this is important, PMDC, CPSP and HAC criteria are applied on the same courses, but they are not similar and standardized, so it is very difficult to start new PT program. So the new colleges or new department must learn that a new course to start is a difficult task or uphill task. Very difficult to start new PG program in public health and community medicine especially, because 95% faculty is curative, surgery, medicine, only 5% people are from the preventive side. Basic side even they don't collaborate with the preventive medicine. They think that we are closer to the clinical side, pathology, even physiology, they people. So health and community medicine in medical colleges and universities, the strength particular in private sector, recently HAC has, so NOC from the HAC is a big problem. And NOC is issued if you have PhD faculty. If you have FCPS, if you have MCPS, if you have any other degree, the higher education will not issue the NOC. So PhD is a future requirement, not only qualification but requirement for such courses. NOC condition, but recently they have relaxed this condition for 5 years, so you can start your courses. So these are the few last points. Yes, these are the curriculum. You can see that MPhil is not a popular